And welcome back. I'm Mabel Jong, and we're at day one of the World Healthcare Congress here in Washington, D.C. And in our studio is Hugh Greene, who is President and CEO of Baptist Health. Welcome.
Thank you.
Well, tell me a little bit about Baptist Health.
Well, it's important to do that. There's a lot of Baptist health systems. Ours is in Jacksonville, Florida. We're the largest health system in Northeast Florida with about a 35% market share. We extend across what most people would know as the Jacksonville metropolitan area.
Okay.
Revenue's about $1.6 billion. And we operate the only children's hospital between Atlanta and Orlando, so a very important part of what we do.
Oh, absolutely. Now tell me, you participated in a panel just now. What were some of the key things that you discussed?
Well, the focus of our panel really had to do with consolidation. And so where that's relevant to Baptist, we have just formed a new entity that spans from Brunswick, Georgia, all the way to St. Augustine, Florida. 3 systems came together and formed what we call Coastal Community Health. And Baptist is the largest entity, but these are also very successful community-based health systems. And so I serve both as the CEO of Baptist and of Coastal Community Health, the new integrated organization we formed.
Okay, do you foresee more consolidation happening in healthcare?
It's happening very rapidly. And I think it's going to continue. I don't see that unabated in the months and years ahead. It's obviously running into some challenges from the Federal Trade Commission because there is this need to consolidate to get the benefit of scale and size. And on the other hand, you sort of got this pressure from the regulators not to become so market dominant as to prevent competition.
Yet does Baptist Health in Florida have plans to acquire more or merge more in the future?
You know, we are kind of butted up against the ocean and now spilled into Georgia with this relationship and down to St. Augustine. I'm not sure we've got a lot of opportunity for further consolidation ourselves, but you know, never say never, because there are some very fine systems that are to the west of us that may come together in a friendly way. But I think right now we need to make this integration work between these 3 systems.
How will the integration result in better and more efficient care for its patients?
Well, I think there's several ways to respond to that, particularly on the efficiency side. We have actually 4 buckets of activity, but inefficiency is one of those. Simply as a function of scale and size, there's efficiency to be gained on the purchasing side as well as particularly information technology, and we've got work groups very strongly working to achieve those efficiencies. But we also want to improve care coordination. So as our industry moves toward population health, we have the opportunity to manage and coordinate care, and we believe improve quality across these 3 former systems that are now working together under Coastal.
Now, is it challenging to merge systems when maybe the other system that you're partnering with works in an entirely different way? The culture might be different as well?
Well, what's really good about these 3 systems is they all are not-for-profit, community-based, historically locally governed health systems. So there is a common sort of identity to the 3 systems. And we spent a lot of effort early on culturalization, particularly among board members and among the administrative team. And if we've done anything well to date, it probably is creating and really emphasizing the common elements of culture. And that's probably the thing I feel most strongly about right now.
You must have a very busy calendar. Why do you include the World Healthcare Congress in your lineup of events?
Well, I think the model of consolidation in Jacksonville is worth telling the story. We did not buy them. It is not a financial merger. And yet we are highly integrated. We got essentially approval from the state's Attorney General and the FTC because we are acting as a single entity. We do have single contracting authority. We have common governance, and we have a single executive leadership. So we kind of are acting like a fully merged organization without financially merging. And the reason that's important, a lot of the smaller organizations don't really want to be taken over, but they realize the need to come together. And so our model is a little different from others, where acquisition is the common thing. So I think it's worth telling that story at the World Health Congress.
All right. Thank you so much for your time today. We appreciate it.
My pleasure.
And I'm Mabel Jong. Thank you for watching. Much more to come.